So in this video, we are going to be looking at some fertility misconception. There are so many informations out there that cause confusion, misinformation, and fear, especially when you're trying to conceive. So in this video, we're going to be looking at some of these misconceptions. And the first one we're going to look at is that fertility has nothing to do with age. Like conception does not have anything to do with age. The truth is it does. So age have very important role to play in conception. In your early years, so between, the late teens to the early 20s to the late 20s, you are still very fertile. Yeah, so it is easier to get pregnant at that time. But once you get to 30, fertility begins to decline gradually. So you discover that it becomes a little bit more difficult at this point to get pregnant. And then when you get to 30, it becomes even more difficult. So the fact is, age has so many role to play in getting pregnant. So don't let anybody tell you that and just continue to be pursuing this, continue to be pursuing that. Age is not a problem, my dear. If you need to get pregnant and every other thing is in place, you're married, you are comfortable and all that, go ahead and have your baby. Then when you've had them, you can continue to pursue your life's career much later. So that's number one. Number two is you cannot get pregnant while breastfeeding. This singular, misinformation have led many women to unplanned pregnancy. The truth is you can get pregnant while breastfeeding. Breastfeeding is actually not a contraceptive method. And also it is possible that your period have not returned, but you're ovulating. I'm saying this because I have experienced this firsthand with so many patients. They are ovulating, their period is not yet back, but they are pregnant. So once you give birth and you start becoming sexually active, ensure that you take precautions. All right, take precautions. Tell your husband, tell your partner, take precautions, because it is possible that while you're still breastfeeding, pregnancy can happen. That's very, very important. The number three misconception is that conception is always very quick. The truth is, it is not so. If couples come out to tell you what they go through before they get pregnant, you'll be surprised. It is only that you get to see the result and then you feel like, these people are just having babies. It is not true. It is not very quick. There are people who, experience a lot of challenges, delays and all that when trying to conceive. So just in case you're trying to conceive and it is not happening immediately, you don't need to beat yourself up too much. The chances of conception in a cycle is only 20-25%. So don't let anybody tell you that this person just got pregnant, this person just got pregnant. Human bodies are different, people are different, and so is their conception journey. So it is not as quick as it is. It takes time, it takes work. So don't let anybody pressure you. That is a misconception. You don't need to get pregnant immediately. Like you start trying this month and then you're expected to get pregnant this month. No, it doesn't happen like that all the time. The next one is women are the only ones responsible for infertility. The truth is men are also implicated. About 30-40% of infertility has to do with men. So just in case as a couple you're trying to get pregnant, you need to explore both options. You need to, check yourselves, both the man and the woman. You need to get checked. So just in case it is happening, it is not just the man. Men can also have fertility issues. And it has been proven that about 30-40% of men experience infertility as well. So you need to ensure that you both get checked. All the necessary tests is done so that if there is a need for assistance, you will be able to get it. So just know that when it is infertility happens, not just the woman is involved. It's just that society has made it look like the role of getting pregnant lies solely with the woman. And if you cannot get pregnant, it means it is your fault. So men are also implicated. So you need to also explore that. The next one is everybody have the same chances of conception. That is not true. That is not. There are so many factors that play important roles in conception, from genetics to the human body structure, size, health, and the rest of them. So there are couples that might just try and get pregnant once, and that had nothing to do with the others that are trying for so long. So it is not everybody that can try and get pregnant at the same time. There are people that get pregnant faster, and there are those that try for so long before they achieve conception. So don't let anybody pressure you to say, okay, this person that just got married have now gotten pregnant. This one that got married yesterday is pregnant, and you have been married 10 years, you're not pregnant. You are not the same. Your body makeups are not the same. So you don't have to beat yourself up too much because people expect that you should get pregnant because others are getting pregnant. There are people that might get pregnant one day after marriage. Some will get pregnant 1 year. Some will get pregnant 10 years. The most important thing is you eventually get pregnant and have your babies. That is the most important thing. The next one is lifestyle choices don't impact fertility. The truth is it does. So if you're smoking, you're drinking, you're eating whatever you like, you're just, not actively trying to keep fit, it can affect your fertility journey. It can affect your fertility. It can affect even your health in general. So the truth is lifestyle choices affect fertility. So in case you're trying to conceive and you're a heavy drinker, you're a heavy smoker, maybe as a man or as a woman, you have to try, to reduce whatever quantity you're taking, because truth is it is going to affect you in one way or the other. So for you to increase your chances of conception, you need to ensure that you are engaging in healthy lifestyle, like eating, exercising, and the rest of them. So your lifestyle choices play very, very important role in conception and fertility in general. The last one for this video is you can't get pregnant immediately after stopping birth control. Now, the truth is, so many people believe that birth controls reduce your chances of conception, or when you come off the birth control, especially the hormonal ones, you don't get pregnant. And some believe that you don't get pregnant on time. The truth is, it is possible to remove your birth control today and you're ovulating today and get pregnant. I'm saying it because I have seen it firsthand happen with patients and other people around. So just in case you are on the birth control pill and you're trying to take it off, you need to watch carefully, because your next cycle might just end up in pregnancy. So if you're not working, towards pregnancy and you're coming off the birth control, try as much as possible to use methods that will prevent pregnancy if you do not intend to get pregnant. So it is a misinformation to say that you come off the birth control and you won't get pregnant. It is not true. So you try as much as possible to take care of yourself, just in case you're coming off the birth control, maybe because of side effects and not because you want to get pregnant. You need to be careful not to take risks, because it may end up in pregnancy. So these are some of the misinformation, the misconception about fertility. There are so many other ones, but for the sake of this video, these are the ones we have been able to look at. So thank